Hello, I'm Dr. Sabine, gynecologist and obstetrician with a holistic outlook, and I'm also the founder of the Hormone Harmony online program. I am committed to women's vibrant health, and today's topic that I would like to share with you is the estrogen metabolism. We all are aware of estrogen. I'm sure you all have heard of it. It's a very sort of widely known hormone, but my understanding and my experience over the years is that very few only know what is actually the function of estrogen and what is this hormone actually doing. And I would like to empower you today a little bit with my knowledge about this wonderful and powerful hormone. The estrogen is not a single hormone, it's actually a group of hormones. It consists of three hormones, which one is the estradiol, which is the most commonly known also as E2. There's the estrone, which is the E1, and the estriol, which is the E3, which is only present in pregnancy. E1 and E2 is also present in men and in women, and the E3, the estriol, naturally, since it's only in pregnancy, only present in women. These is the group of hormones which are called estrogens. So the group of estrogen is primarily produced in the ovaries and the testes, but it's also produced by the adrenal glands and in the fat tissue, which is important to know. The main function of the estrogens is the sex hormone aspect, which is puberty, fertility, and reproductivity in women. In men, it's responsible for the maturation of sperm, and funny enough, also for the amount of libido that men are experiencing. It's not only testosterone related, also estrogen related. The estrogens are extremely powerful and extremely important, and it's very wonderful to have them, and it's very powerful also when they are in decline or when we have them excessively. So this is something that we need to look at for you to understand. As estrogen is a very powerful hormone that is responsible for a lot of things except for fertility and puberty and reproductivity. It also influences the cholesterol metabolism. It helps the bone health, the heart, the skin, everything. But the estrogen as an estrogen in terms of levels, the estrogen dominance is what really affects us women today to a great deal. So estrogen dominance means that we have too much excess estrogen circulated in our body, which is sometimes not only a question of numbers, where you actually see it's above 150, 300, but it can also be, you can also become estrogen dominant in the phase where your progesterone is so low. So it is also seen, and very important to be seen, in relation with the progesterone. So you might have 150 level, which is a normal level, but in absence of progesterone, it becomes dominant. So estrogen dominance is something that is very difficult to handle because you become aggressive, you have excessive bleeding, you might have spotting, you feel very bloated, water retention, all of these things. And it is also dangerous because it can affect your health in terms of cancer, especially breast cancer, is something that is very much to watch out for. For me, in my clinical practice, what is really important and is something that people don't think about is actually how the estrogens leave the body. So let me repeat, you have your estrogen peak when you ovulate, and then it drops down, comes to its lowest level when you're actually menstruating, in order to then come up again to your ovulation level. So there's not a single day that you have an estrogen level that is the same. So every day it fluctuates, and that's why it makes us women also such special creatures, because we have this multicolored, everyday different hormone levels. But that's on the side. So when the estrogen actually leaves the body, that's where it's broken down in the liver. And the liver can choose certain pathways how it metabolizes the estrogens. This can have a genetic disposition, but a great deal of which pathway is chosen has to do with your diet. And the pathways, they end up with good estrogen metabolites and bad estrogen metabolites. The good estrogen metabolites actually are highly antioxidant. They protect the brain, they protect the heart, and they're very beneficial for the body, so we definitely want to have loads of them. And the bad metabolites, they are obviously not good for the well-being, and they are, precursors of cancers, and they create weight gain, belly fat, and all these things that we have discussed so often. So we need to really make sure that we help our liver to choose the correct pathway for the estrogens to break down, on the good pathway, obviously. And this is something you can actively influence with your diet and with some dietary supplements, with the choices of food that you make. So, something that is really important and helpful are the crucifers, so all the cabbage, the broccoli, the curly flowers, these kind of vegetables, they're really helping very much to break down the estrogen down the good pathway, with the result of a high antioxidant and protective metabolite that circulates the body and eventually leaves the body. So vegetables, crucifers, and there are some supplements that you can actually take as an additional help. One is called DIM. It's called indole 3-carbinol, which is in the same way supporting the liver to choose the correct pathway. So it is important for you to understand that estrogen excess and estrogen metabolism is something that you can influence in a positive way with shifting it towards the good pathway and having good metabolites. It's also something that I check in my clinical practice with measuring the urine metabolites in the urine, so we can actually see the ratio between the two. If the good and the bad are balanced, if they're in the balance towards the bad, then we take actions, because remember, we want to be a step ahead. We don't really want to end up with cancer and with diseases and with belly fat and all of that. We want to be a step ahead, and that's why I'm sharing my knowledge and I'm going online, and I want you to hear this from an experienced doctor like myself, so that you can empower yourself with little steps to take. So this is important to me. Estrogen metabolism, don't be afraid of the hormones. Help them leave the body safely so that we're all in a better place. Thank you very much.